yet. She might be here at the very end, but she had a chamber event, so you're stuck with just me right now. For those of you that I don't know, my name is Carrie Gray. I'm a safety consultant from the BWC, and I'm just going to run through a couple updates that you're used to. We ask one, that you mute your microphone, and two, that you turn your camera off. That would be helpful. Then we have enough bandwidth and we can see everything. But if you do have questions, the chat is awesome. Feel free to put anything down at the chat. If you don't see the chat, then you can click, like, kind of hover at the bottom of your screen, and the chat box will pop up there and you can go from there. So that being said, we're going to go through the BWC updates, and then we're going to hand it over to Dr. Atta. And like I mentioned, my name is Carrie Gray. I'm covering up my contact information there. But most of you know me. I am still here for you. I am here virtually, but we're also doing some on-site visits as well. So just know that that is out there and available for you. But don't not do safety because the Bureau wasn't there 100% to help you. We are always here, just sometimes a little more virtual than we were. We do have a lot of webinars coming up, and I have a record-keeping seminar coming up as well at the end of the month, and I'll show you the information on that. But you can see the webinars. And bear with me, I'm trying to let people in and click and change and do all this at once. We have a lot of classes as well through the BWC Learning Center. Those are all free, and we have those scheduled for actually the whole calendar year, but hopefully starting after July, we're going to be able to have some in person, so that would be great. Let's see, right now, especially after yesterday, the new snow and ice YouTube video would probably be pretty helpful to train your folks. Know that that's out there. All kinds of resources like what I talk about every single month, but know that that is out there and available. This is a record-keeping webinar, and it's kind of an open house. I'm going to talk for a few minutes, and then we're going to do a lot of question and answers and send you some materials. It is Monday, January 31st at 11, and Stephanie will send that out so you can register if you're interested in that seminar. We've been talking for most of the year about OSHA's top 10 and what they're citing the most and things like that. January was a planned break from that topic because there's obviously more than 10 months in a year. So January, we're kind of shifting gears a little bit, but just know that these are out again. They've changed a little bit, but not too much. But I always like to challenge everybody in January is, what have you set for your 2022 goals? And if you haven't, or you don't know what to set, or you have no ideas, give me a call. And of course, my dogs are going to lose their mind right now because I'm talking, and that's just how this goes. So listen to my dogs lose their mind for a moment, and I will pass it along to Lisa. I know, Lisa, you wanted to introduce Dr. Atta. Let me get his slides, but you can go ahead and start talking now.
Awesome. Thank you, Carrie. Well, good afternoon, everyone. I am Lisa Horning with Summa Health. Thank you so much, Carrie, for the opportunity. I miss all of you guys. Gosh, it's been so long. So we are here today. I am thrilled to bring Dr. Atta back in front of your group today. This man is a wealth of knowledge. He has been our medical director at our corporate health facility. He runs and operates 5 of our different clinics, and I think he does a tremendous job. One thing that I can say, personally about Dr. Atta, the good thing about him is, as an employer, be rest assured that anytime you send your employees in to see him, he is a very caring individual, and in addition to that, he will make sure that your employees are well taken care of, and he takes the time that he believes that each one of your employees needs, and answers their questions, make sure that they understand that it's really important to get back to work in a safely, timely manner. So without further ado, I'd love to turn it over to Dr. Atta. If you have any questions, feel free to put them in the chat. Carrie and I have worked together for many years. And again, Carrie, thank you so much for allowing us this opportunity.
I am glad you're here. Dr. Atta, I don't have your slides. I don't know if you emailed them or if anybody else on that email got them, but you're welcome to just talk and go without slides if you're okay with that.
Okay, will do. So good afternoon, everyone, and welcome to this talk. Thank you for this opportunity to discuss this talk. My topic for today is the one big thing that's hanging over all of our heads is COVID-19 in the workplace, and to give updates on our current state of affairs, where we are as a nation with respect to the workforce, and to bring all of you up to date on and help provide some clarification on the confusion that is out there with just people being so tired of dealing with this, people not understanding exactly what the medical guidelines are, and for employers, just a few tips on how to interact with employees as well as customers as we deal with this going forward. So the first thing I'm going to do is just do a quick look back on some of the things that we talked about. It's now been 2 years, but approximately a year ago, we were talking about COVID-19 and not really understanding what this virus was causing. But even back then, we knew that it was a virus, that it had an incubation time of between 2 to 14 days. In other words, that if you were exposed to someone that had COVID-19 and you got this virus into your body, that it would take anywhere from 2 to 14 days for you to develop the illness. The average time has run around 5 days, and that has stayed about the same. We know that it is spread through air droplets, and that the spread through contact of surfaces and so on is actually much less than we thought. Back then, we were talking about the virus being on surfaces for up to 3 hours at a time. Now it's actually closer to 30 minutes that it is viable on hard surfaces. But the one thing that has stayed the same and possibly gotten worse is how contagious it is. One of the things back then we compared it to was the flu, and we found that it was 2 to 4 times as contagious as the flu. These days, with the current variant that we're looking at, it's probably closer to the 4 times more contagious. We also realized back then that there was an issue with respect to people who did not show symptoms but were potentially carrying the virus. So asymptomatic people who were also potentially able to spread the disease. Now, we have ended up classifying that into 2 categories. Number one is people who are asymptomatic because they have the illness but have not started to show symptoms yet. It's only a matter of time before they show symptoms. And in the meantime, they aren't showing symptoms yet, but are still very contagious and can spread. There's also a second category of people who never really develop illness. They carry the virus around, are potentially able to spread it, but never fall sick. And that, again, has stayed the same as we have gone forward. We have noticed that there are fewer and fewer asymptomatic people who don't get sick at all. The majority of people will exhibit some form of illness. The issue is how mild, how moderate, or how severe it gets. Back then, we talked about trying to contain the virus, and at that time, we looked at things like restricting travel, doing contact tracing, and doing quarantines. Right now, we are still trying to quarantine people who are extremely sick, but otherwise, if you have mild illness, we're not really quarantining people. we are still on occasion, not as often, are still restricting travel from outside countries into the United States. But within the United States itself, travel restrictions have generally been significantly reduced. When it comes to testing and contact tracing, that is still ongoing, particularly the testing part. The contact tracing has gradually diminished. With testing, we are recommending it. The problem right now is that we don't have many tests available. But those measures are still in place as containment measures, which is essentially to try to prevent the infection into any group of people or any population. These days, we're realizing that if a variant is announced across the world somewhere else, even if we restrict travel and all that, before we know it, the variant has probably been here. And so the containment aspect of trying to prevent the virus from coming into across our borders is not being emphasized as much. What we are doing is more of mitigation, which is trying to reduce the spread amongst the population. And so we all have heard this so many times about infection control, washing your hands, distancing, wearing masks, disinfecting surfaces, and so on. And that is still going on significantly. Without any doubt, one of the biggest things we know is that distance from someone who has the illness is very significant. The closer you are to that person and that person who has the illness, and also the absence of masks means that that person can share the virus much more easily. It is much more important for someone who has the illness to put on a mask. That is probably the highest priority. It is important for all of us to put on masks to prevent breathing in droplets from a source. But most importantly, people who have potential illness definitely need to put on masks. The closer fitting, the better. And we're going to talk a little bit about the different type of masks in a minute. We also know that closed areas tend to circulate the droplets much better than open air. And so guidelines for if you work in a warehouse which has doors open and there's better circulation of air, those guidelines are slightly less restrictive as compared to working in a small office space with lots of cubicles and possibly not as good air circulation. So that was a year ago. Since then, we have had to deal with a lot of fatigue. And by that, I mean people being extremely tired with respect to expecting that this pandemic would have significantly reduced, and people wanting to go back to their normal ways of life, being able to gather in restaurants and bars and family gatherings, and still having to work through restrictions. I think that is probably one of the biggest things that a lot of people struggle with currently. In addition to that, there is confusion because the medical evidence that keeps coming out and the medical recommendations occasionally seem confusing and sometimes to contraindicate each other. So you hear something 2 weeks ago, and today you hear something which seems different. And that is causing difficulty with people even trying to follow these guidelines. And then there are things like issues with, of course, vaccinations, issues with figuring out what variants are, and issues with mandates. So I wanted to kind of update that a little bit. Let me start with the issue of variants. One of the things about viruses is that they reproduce extremely quickly. Within milliseconds, viruses are always reproducing. And with reproduction going on that quickly, there are going to be mistakes made in reproduction. And so Um, the grandchildren of one particular virus may turn out to be slightly different than the grandparents, essentially. And what happens is if that grandchild is slightly different and yet is still able to survive within a human being, that grandchild will gradually reproduce on its own a kind of a different strain. And essentially, that is what we consider to be, those are what we consider to be variants. The more likely you are to have viral reproduction going on in your body for a longer period of time, the much more, the greater the likelihood is that you're going to have variants gradually developing. And I'm going to keep away from politics and all that, but this is a situation where we are encouraging people to be vaccinated, because if you have increased immunity from vaccines, then our body's immunity tries to kill off the virus as quickly as possible while it's in your body, and therefore reduces the amount of time possible for variants to develop. This is an international problem, because even if we continue to vaccinate and boost, there are countries out there which do not have enough vaccine. And so it really behooves us as a planet to try to develop and share vaccines across the planet, because if we get all our vaccines and get all our boosters, and someone in Afghanistan, for example, hasn't gotten a vaccine or a booster, and they get COVID, there is a possibility that they might be the source of the next variant. And so that's the issue with variants. For now, with respect to the medical directives, it is still important to maintain the same old guidelines that we started with. It is still important to try to keep people wearing masks as much as possible. And I have a personal thing that I try to educate people about, which is your mask should try to cover your nose and your mouth. It's not a mask beard, it's not a mask mustache, it's a face mask which should try to go from the bridge of your nose to just underneath your chin, ideally. So that is still very important. Physical distancing where possible is still very important, and hand washing is still very, very important. There is no doubt that the vaccines are extremely important. Initially, it was thought that you could get 1, maybe 2 shots of the vaccines and you would be done. With the rapidly developing variants, we are realizing that you may need boosters. And so that is the current state of affairs: is masks, hand washing, physical distancing, and where possible to get vaccination or boosters. It has been determined that Moderna and Pfizer help an individual to develop much better immunity than Johnson & Johnson, with the initial variants to start with, and then with both the Delta and the Omegran viruses variants as well. So those two are more highly recommended than the Johnson & Johnson vaccine.
Dr. Atta, this is
yes,
Lisa. May I just ask you a quick question, please?
Yes.
And I'm sorry to interrupt you, but I have this question that came over, and I think this is a very, very applicable question to the group. Because we're one of the largest employers in the county, when the employees are coming in, what are some of the common things that you hear from employees when it comes to, being worried about going into work, or, I'm not feeling well. How do I know if it's a cold? How do I know if it's the flu? Or how do I just even know if it's a sinus infection? So do you mind sharing some common concerns?
I will, but I'm going to get to some of those in just a minute as well.
Awesome. Okay.
And then finally, there's the whole thing about mandates and the issue of companies being ordered to, if you have over 100 employees, to mandate that your employees either be vaccinated or that your employees do regular testing. Well, that is a little bit of a problem because forcing people to get shots has proven in some cases to be difficult and not very popular. And then secondly, there has been not in certain cases you can't get tests. So these are some of the things that employers are having a problem with is maintaining distancing, ensuring that there are enough masks for their employees, trying to decide if they should mandate that their employees should get vaccinated, and where their employees are not getting vaccinated, trying to figure out where they can get tests. And none of these answers are easy right now. The other thing that we're seeing with a lot of employers is that people have stayed home because now employees truly have choices out there with job opportunities. So the job market is really tough for the employers to find qualified applicants. And so a lot of employers are really struggling with that and struggling to attract people. I had an employee, this was probably about 3-4 months ago, while we were waiting for the lab to do his urine drug screen, he had 3 other offers from 3 other employers. And he ended up choosing to go with one other who did not require a urine drug screen. We're seeing employers who are having to cut back on some of their requirements. A few employers have decided to cut back on requiring a drug-free drug test. And some of them are deciding to accept people who use marijuana, not the others, but marijuana, just to be able to get employees. So on the employee side, on the employer side, these are some of the difficulties that they're facing. With the employees, I have to say that the employers have actually done a pretty good job from what we see with masking, providing hand sanitizer, trying their best to distance. So the employees do not really have too much of a problem at work. However, that is also dependent on the particular workplaces. For example, when it comes to things like nursing homes or the healthcare institutions, exposure is slightly higher. There is a lot of just innate fear and concern about what you may be bringing home to your family. And I would say those are the common concerns that we have seen so far. Right now, we have 2 big variants that are floating around, the Delta variant and the Omegran variant. The Omicron variant, as we know, is more recent. It's been around for about 3 months. It is extremely contagious, but we are gradually finding out that it is not as severe when you get infected. The Delta variant is also contagious, just not as contagious as Omicron, but it's usually the Delta virus that causes people to be hospitalized, admitted, and sometimes taken to the ICU. We are still seeing that the majority of people who are hospitalized and the majority of people in the ICUs are people who are not vaccinated. At some point, it used to be about a 90 to 10 percentage, 90% of people in the ICUs not vaccinated versus 10% being vaccinated. Now it is closer to about 70 to 80% of people not vaccinated, and somewhere between 20 to 30% of people who are vaccinated. We think that the numbers that we're seeing currently are due to just the sheer numbers, because Omicron is so contagious that we're just seeing so many more people get infected. And even though most of those infections are mild, we're still seeing so many more people who are having severe enough infections to clog up our emergency departments and our hospitals. I think Ohio, for the past maybe 2-3 weeks, we have been averaging 20,000 cases a day, 20,000 new cases a day. And we are running somewhere between 1,000 to 1,500 new cases a day that are being hospitalized across the state. Northeast Ohio has been hit extremely hard. About a month ago, Cuyahoga County had the third highest rate in the entire country, was how bad it was. And Summit County was in the top 10 in the entire country. So we are still being hit very hard. Previously, with symptoms, we knew that it was upper respiratory symptoms, nausea, vomiting, some diarrhea. And then the big one for us was loss of smell and loss of taste. However, now with Omicron, we are seeing a lot of symptoms that are just like upper respiratory symptoms. So that goes to Lisa's question. At this time of year, we usually have the common cold and we have the flu. Occasionally, some people have some allergies, and now we have COVID. So how do we differentiate from all of these? First thing I'm going to start with is just allergies. Most people have a general idea of what allergies they have, when they have allergies, and what kind of symptoms they have. So we are seeing a few people that come in and say, every January, I get a cough and sniffles, and what I'm having right now is very similar to what I've had every year for the past 8 years. The other thing about allergies is that usually it is restricted to just upper respiratory symptoms, so nasal congestion, coughing, sneezing, where you usually will not have a fever, you usually will not have chills, you're not going to have body aches or generalized weakness. So if we see people who say that their symptoms are similar to what they've had in the past, and they do not have fever, chills, body aches, generalized weakness, or fatigue, that is much more likely to be simple allergies. When it comes to the common cold or the flu or COVID, those three are much more difficult to differentiate. We know that with COVID, especially with the Delta variant, a lot of people are still experiencing issues with taste and smell. So that is still a pretty good giveaway that you have COVID and you probably have the Delta variant. When it comes to Omicron, when it comes to the flu, when it comes to the common cold, those are more difficult to differentiate because they all will have the upper respiratory symptoms. They all will have some degree of fever and chills, and they all will have some muscle aches. So with anytime someone comes in with any of these symptoms, we definitely at Summa, we are testing people for all three. We're testing people for the common cold, we're testing people for the flu, we're testing people for COVID to differentiate. Because at this point, especially with Omicron, it's difficult to tell the difference. The one thing we are using though is that we are looking to see, number one, if anyone else close to that individual has had the same symptoms. And then number two, if the symptoms last longer than 24 hours. So if you come in with a history of your spouse having symptoms, especially if your spouse has to maybe stay home and you have developed the same symptoms and they're not getting better after 24 hours, we're recommending that you go get tested. And ideally, if there are tests available, we are actually recommended that you get tested twice because the best times to test where you have enough of the virus in your system to actually show up on a test are probably anywhere from day 4 going. So if someone has developed symptoms and they do a test on the first or the second day and it's negative, well, that's good. But if you continue to have symptoms, we definitely recommend that you get a second test maybe 2-3 days afterwards. And if that also is negative, then you're probably clear of COVID. And it probably is either the flu or the common cold, and you can be treated accordingly. So that is what we're doing now. We have noticed that there has been a huge shortage in home testing. kits available. At some point, we had the libraries, we had the county, Summit County Department of Health were giving away free rapid tests. They are out. They've been out for over a month. And at that time, even pharmacies were running short on testing. Over the past week or so, I've been getting more and more reports of pharmacies being able to get the tests. Unfortunately, you have to pay for them. And I honestly am not sure. I know some insurances cover the cost, some don't, but at least the tests are more and more available at pharmacies. And so we are recommending that people try to get home testing kits for themselves and test if they have symptoms, especially if the symptoms last more than 24 hours. And the last thing I wanted to touch on, and then we can open up for questions, was treatments. Paxlovid is a new treatment which has been FDA approved, that it can be prescribed to treat COVID. Unfortunately, extremely limited supply, and currently most supplies are limited to hospitals. So hospitals are being able to dispense them. I heard on the radio this morning that university hospitals had enough supplies for, I think, 500 people. Summa had enough for about 300 to 400 people. So we just don't have enough. The hospitals are having to stratify people who have mild symptoms, actually who have moderate symptoms but are not bad enough to come to the hospital, and are treating those people. But we're hoping that over the next few weeks, we can have more of this medication so that general practitioners can begin to prescribe them for employees. But we strongly recommend that if you have symptoms over 24 hours, you get tested. If your tests are negative for COVID, you try to notify your primary care provider if possible, just to keep them aware, because they might want to start treating you for the flu. We don't want to focus totally on COVID and forget about the others. The last thing I want to talk about is the issue of vaccines. I think Ohio is somewhere in about the 60% range of adults who have been vaccinated. This has turned into a very high profile issue. One of the things that I tend to do is, at this point, leave the science alone, and definitely calling someone stupid or an idiot is the extremely wrong thing to do. Different people have different reasons for this, and I would urge some degree of grace and consideration when discussing vaccination with people, especially if you're trying to recommend that people get vaccines. The old adage, you get more with a teaspoon of honey than you do with vinegar, or something to that extent, is still very, very important. And so trying to explain to people that it is useful is far better than calling people names. And we just have to accept the fact that there are some people who just are not going to accept the vaccines, and that is fine. We all can just do what we can do, which is to try to maintain precautions. And I would recommend for employers that we continue to do that. Just try to maintain a safe and clean workplace environment, and respect the fact that different employees have different opinions about this, and that is acceptable too. Okay, so said quite a bit, and I'm sure there are a lot of questions. I'm going to open it up and fire away.
Dr. Atta, one of the attendees said that one of their struggles that they're having is really trying to stay current on all the CDC guidelines. I think you did touch on this earlier in your presentation, that oftentimes it changes daily and sometimes, hourly. So that's one of his concerns.
It's not easy. We continue to learn about the virus, and we continue to learn about different variants. We continue to learn about how effective vaccines are and how long vaccines last. We continue to learn about side effects of COVID, side effects of vaccines. Now we have a medication that seems to be extremely useful, and we will continue to learn about that. So I happened to do my occupational medicine residency at Emory Hospital in Atlanta, which was right next to the CDC. So we did some rotations through the CDC. Those guys are fine people who mean the best. They may not be great communicators, but they really want the best. About a year ago, when we started rolling things out, we had webinars. Our department here at Summa had webinars. And at the time, I offered that if anyone had questions, they could reach out to me, and I would try to provide some clarity. And I'll still propose that because the news comes thick and fast. And sometimes, even for us medical professionals, we're constantly struggling to keep up. Because again, as this virus and as this pandemic keeps being studied, information keeps coming out all the time. So I can offer that if people have questions, I'm sure at the end of the presentation, Lisa will offer my email or phone number, and I can try to help make sense of this. We just have not had time. Summa has probably 8,000 employees, full-time employees, and we also have about another 1,500 to 2,000 volunteers, medical students, residents. So just keeping up with our staff alone has been extremely time-consuming. One of the things that we had hoped to do was to put out some sort of a newsletter, which would have provided some clarity, but we have just been so swamped that we have not been able to get to that. I would say if you truly have really deep questions about this, please reach out to me and I'll try to provide some answers.
Awesome. Dr. Atta, we do have a question. One of the questions would be with the Omicron variant, do you know that if Pfizer or Moderna, if one is more effective than the other?
So if this was a NASCAR race, Moderna would be ahead by a nose, is what the science has shown so far. Moderna would be ahead by a nose, but they both still give extremely good protection. And when in doubt, I would take either of them. I happened to get Moderna because at the time, that's what Summa had available, and that's what they offered to all the Summa staff. But either Moderna or Pfizer is good.
Okay. And then if, let's just say an employee or a patient started with one manufacturer over the other. So let's just say they had the first two vaccines with Moderna. Do you recommend them continuing with Moderna, or does the science say that you can switch manufacturers?
It makes it just easier to track that person if you stick with the same vaccine. But if, for example, you've had 2 shots with Moderna and you're looking around and you cannot find anyone who has Moderna, and maybe your primary care physician or a local pharmacy has Pfizer, I would take that. If you are inclined to take it, I would definitely take that. Mixing them up does not hurt. It helps. But just for tracking purposes, and just assuming that if you have tolerated Moderna okay, then it's probably better just to continue with Moderna if it's available.
Okay, awesome. We do have another question. It's they're stating, with the virus becoming less virulent but more contagious, do you see it eventually burning itself out?
Yes and no. So the University of Washington in Seattle, Washington, is probably the best academic institution that has developed statistics that kind of predict the span for each surge. We are currently looking at the current Omicron virus peaking sometime within this week to next week, and starting to decline into mid to late February. So that we think is going to be the nature of the surge. I will say that previous predictions have been overestimated. And I think part of that is that people do try to take precautions as best they can. And then our medical institutions are doing the very best they can. But currently that is the predicted curve that we're looking at, peaking this week and then slowing down into middle of February, late February. So that surge, we think by then, this surge would decrease. It's not going to go to zero, but it's going to decrease. I think the concern right now is that it may be a matter of time before we get another variant, and so that's the concern. And if an entire population is highly vaccinated, then the risk of another variant running rampant is decreased. If not, then there's still a possibility that another variant could possibly could cause some havoc. In some ways, we're lucky with the Omicron variant, because even though it's very, very contagious, it's not as severe. And so fingers crossed, if we do have another variant, that it'd be more of the same, or maybe slightly less of the same, but just difficult to predict what the next variant is going to be like. So this variant will turn out by end of February, but we don't know when the next one will be.
Okay, very good. Another question, with many vaccines in the world, they gave an example of Sputnik, Sabarana, if I'm pronouncing that right. Have they seen the same type of results versus Pfizer and Moderna, or could each of the countries have different vaccines that help create different variants that may not be able to, we can keep up with?
Tough question. I will say that the United States, and I can share, if there's a contact person, I can share this, but we at Summa have used this because we are closely affiliated with NeoMed, our Northeast Ohio medical school. And we have a lot of medical students that come from other countries who have had other vaccines. And so we have looked at what vaccines we consider to be acceptable here in the United States. So some of the international vaccines are acceptable, some are not. And so we have a list that we currently go by, and I can share that if there's a contact person. So I think the risk of developing variants is primarily worse in areas which do not have vaccines at all, as compared to people who have vaccines. Other vaccines may not be as powerful, but they all still confer some degree of immunity, which is useful because, as I said earlier, once you have a good amount of immunity, it does not stop the virus from getting into your body, but it stops the virus from staying in your body for very long because your immunity immediately attacks it.
Okay. All right. Very good. So one of the questions that we also have is, you had made mention that we initially thought that the virus was live on a hard surface, just say, but then you had made mention, how long did you say, are they saying now that it stays live on a surface? Now
we're looking at somewhere in the region of about 30 minutes. Before 30, we thought it would stay up to about 3 hours. But now we're looking at 30 minutes. And I don't know if anyone has realized, but more and more sanitary wipes and hygienic wipes are advertising that if you use them, they're effective against COVID-19. Personal hygiene with hand sanitizer and also with wipes on surfaces have been shown to immediately remove not 100%, but over 95% of the viruses on hard surfaces.
Okay, so continue as an employer using safe, cleanly practices. You always have, because with the new variant, who's to say, right? Who's to know how long that it's lasting? All right, another question. We're getting some questions regarding, Dr. Atta, do you have any good information that you can point us to in relation to blood type and the severity of these different illnesses that we're getting?
So no, I do not, unfortunately. But I can check and again, try to get back to you definitely either by the end of today or by end of tomorrow for sure, and see if there's any clear information. So far, some of the science has been mixed on that, but I can just double check and try to send some information your way.
Sure. Another thing is, you had made mention that, let's just say you have some upper respiratory symptoms, stuffy nose, like a headache, sore throat kind of thing. You go and you get tested and you test negative. You had made mention to go ahead and get tested again. Could you, is this giving people a false sense of security? Let's just say, for instance, I'm not feeling well over the weekend. I know I have to go to work on Monday. I take a test on Sunday. It's negative. So I think I'm good to go. I go to work on Monday, still have the symptoms, and now I've tested positive. Are these tests giving some little bit of a false sense of security there that they are negative?
Well, if you ask the people that produce the tests, they will quickly show you that in their paper, their literature says that it's not 100% valid. Also, we know that if you should get the virus into your system, that it's a matter of the virus reproducing in your body. And so the first couple of days, you have actually very low levels of virus in your system. And therefore, it's tougher for some of these tests to pick up evidence of the virus in your system. So what we recommend is, number one, do not test on day one. So if you're exposed to your spouse on Friday, midday, don't go get a test Friday evening and test. I would recommend waiting at least 24 hours to see how you do, and then do your first test. The second thing is whether you have symptoms and how significant your symptoms are. Generally speaking, if your symptoms are mild and stay mild or get better, then there's no need to test. You're probably fine and you can go to work so long as you take your precautions. It's those people who have moderate to severe symptoms that persist, or people who have mild symptoms which ramp up. Those are the people that we highly recommend that you do another test about 3 to 4 days after the first.
Okay, and a moderate symptom obviously would include a fever, but what would be another example of a moderate type?
Give me just a second, let me pull this up for you real quick. The CDC actually lists mild versus moderate symptoms. And I'll just run through this real quick. But mild symptoms include someone who has a mild cough, mild sore throat, and a fever which is less than 100 degrees. It's actually less than 100.4 degrees are considered mild symptoms. Moderate symptoms are the same things, a cough, sore throat, but if your fever is higher than, is 100.4 or higher. If you start to get muscle pain and headaches, if you start to develop shortness of breath, chest pain, extreme fatigue, where in certain cases, I've had patients say, getting up from their couch to go to the bathroom and walk back, they feel like they're tired or they're short of breath, or climbing the stairs to go upstairs to their bedroom. By the time they get to the landing upstairs, they're having to hold on to the railing to catch their breath a little bit. Those are considered moderate symptoms. So things that we associate with a common cold, a cough, sore throat, a fever less than 100.4, some nasal congestion, those are considered mild. The shortness of breath, the trouble breathing, fever 100.4 or higher, wheezing, and extreme fatigue are considered moderate.
Okay, very good. And then someone does have a question. Let's just say, for instance, they test positive for COVID. How long does a person need to wait in order to either A, get the vaccine, or B, get a booster?
10 days. It used to be 90 days, but now it has been reduced to 10 days. So anytime 10 days after you develop symptoms or 10 days after you test positive, you are able to go get either your first vaccine, second vaccine, or a booster safely. Of course, there are certain there are certain reasons why you should not get the vaccine if you have a clear allergy to the vaccine or a component of the vaccine. And I usually tell individuals, if you have a severe enough reaction to the vaccine, you are probably going to an urgent care or your primary care physician or to the ER. I've had patients who have said, I feel like I reacted to the vaccine, but I stayed home, drank some tea, some orange juice, and so on, and I felt better, but I think I had a reaction. Usually what is considered a significant reaction is probably causing you to seek some medical attention.
Okay, and then would that hold true also for a flu vaccine? So let's just say that a person tests positive on Friday and for COVID, and they're concerned about the flu. Should they also wait 10 days or should they wait longer?
No, they should wait 10 days. 10 days. Again, I'm assuming that after 10 days, the person is feeling better. Even if their symptoms have not cleared, their symptoms have significantly reduced. 10 days, they can get the COVID vaccine or the flu vaccine, and you can actually get both of them at the same time. However, 10 days later, if your symptoms are still moderate or severe, or 10 days later, if your symptoms have ramped up from mild to moderate or to severe, then no, you should not be getting the vaccine at that time.
Okay, very good, very good. Carrie, are there any other questions that we haven't addressed, or any that you
I'm not seeing any in there. If anybody has any last minute, it looks like it's about time to start wrapping it up.
Okay, very good. Well, I guess I'm just getting a couple more, and then I'll just wrap it up. One of the questions.
So I see one that I want to jump on real quick. There was a question about people who have had COVID and why we don't do antibody tests to determine immunity and why that is not acceptable. I think this is a very valid question, and this has come up multiple times. What we have found so far is that for some strange reason, which has not been explained yet, the immune levels in people who have had COVID illness, our natural immunity tends to be extremely variable for some reason as compared to the vaccines. So with the vaccines, you can pretty much guarantee that you will have some level of immunity, which we deem to be pretty protective. With the illness, for some reason, we're noticing different individuals with varying levels of immune cells and immune protection. And this is the main reason why it has been determined that it is much better, whether you've had the illness or not, to go ahead and get the vaccine, because with the vaccine, you can pretty much guarantee some baseline of immunity, whereas with the illness, you can't. So that has been the issue. Okay. And for some reason, the antibody counts that we do in people who have gotten the illness does not really seem to correlate very well with actual protection. And again, this is being studied. It's not fully understood as compared to 50 years ago when people had, I think it was measles or chickenpox parties, and you go out, you'd expose everyone, and you knew that you get adequate immunity. For some reason, our natural immunity is very variable. And so the recommendation has been to lean towards the vaccine.
Okay, awesome. Just one final question, then we will wrap it up if that's okay, Carrie. This is an excellent question. So in order for an employer to develop future initiatives, are you hearing any common themes about mental health with employees during this, unprecedented time?
So this is my pet thing in occupational medicine. Number one, as employers, within reason, be supportive. Number one is that in general, employers that are seen to be much more supportive seem to have better buy-in from their employees. When someone is out sick and their supervisor calls to check on them and see how they're doing, those employees tend to return to work much quicker than employees who feel like the company does not care about them. So that's number one. Number two is just consistency from top to bottom. So from the CEO to the janitor of maintaining these consistent guidelines seems to be much more helpful than where the employees feel like the burden is being put on them, but the people in the C-suite don't seem to wear masks or care. I would say those are my two big things that I seem to have noticed. Employees are tired; they are fatigued with the mandates, and then of course the other thing is now employees seem to have much more of a choice. So it really behooves employers to be seen to be more caring, and I think it helps maintain employees in workplaces.
Awesome. Thank you so much, Dr. Atta. Carrie, thank you for allowing us this opportunity, and thank everybody in the audience for attending this seminar. And, we always like to speak on topics that you're interested in hearing. So if there's a topic, I know Carrie is fabulous about working with the committee of creating topics, but feel free to do so, sending me an email and saying, hey, we would like to learn more about this topic. And we will make those connections to make that happen. And then I believe, Carrie, you're recording this. And if, again, we hang up and people still have questions, Dr. Atta is very accessible, although it's a busy time for him right now. He will do his very best to answer your questions. So thank you so very much.
Awesome. Okay. Well, that is all we've got, guys. Thank you, Dr. Atta. Next month's meeting, February 15th, same third Tuesday of each month, just like we always do. And I was going to pull that up, but I'm not sure that that'll work. Let's try to get it to work right now. If there is any questions or anybody has anything for me, feel free to, did that share the right screen? I can't even tell anymore.
It looks good. Looks good.
All right. So it's on there. If anybody has any questions, please just let me know. We'll do machine guarding in February, and I'll be around for a few minutes in case anybody does have any questions. Make sure you do your record keeping. Even if you don't come to my seminar, your record keeping, if you submit it to OSHA, has to be done by March 2nd. And if you have to make sure you have to post it somewhere in your facility February 1st through April 30th. So if you have any questions on that, I'll stick around for a few minutes. Otherwise, free to go. Thank you guys for joining us, and very good meeting.